Hi, hello, fellow Full Plate members. We are so glad that you're able to join us today. I'm Amy Hannes with Full Plate Living. I also have Michelle Jones with Full Plate Living.
Hi.
Hello, Michelle. And we are very excited to have Dr. Michelle Tollefson with us today. Hi, Dr. Tollefson. It's nice to have you.
Thank you for the invitation. I'm excited to talk with you today.
It is great. We are really excited to bring this presentation to you on menopause. It is such a topic that all of us women need to know more about. So it's definitely something that we hear a lot within our memberships, and really glad to have you here. But before we kind of dive into this, I'm going to hand it over to Michelle Jones for our housekeeping.
All right. I see that everybody's found the chat, and I love to see all the comments of where you're from. It looks like Ohio, Atlanta, Florida, probably quite a few other places, Virginia, Texas, Cincinnati. Welcome, everybody. I do want to know that you can use the chat throughout the workshop. In fact, we want you to use the chat. If you have any questions, please post them. I'm going to mark them as questions. And after the workshop, we're going to go ahead and go through some of those questions, as many of them as we can. We do want to be mindful of your time. And then I'm going to talk a little bit about technology. Technology is great when it works, and then when it doesn't, it's frustrating. So just to let you know that the program we use, Demio, works best in the Chrome browser. So if you end up having issues, if you get dropped, if you can't hear us, if you can't see us, the first thing you can do is refresh your browser. And if that doesn't work, try it from the Chrome browser or from a different device as well. If all else fails and it just doesn't work for you, we will have a recording of this and we will send an email out with it so you can still watch it that way. All right, at this time, I think I'm ready to turn it over to you ladies.
Excellent. Thank you, Michelle. All right, and it's just great to see so many people joining us from all over. So it's the great thing about technology when it does work great. Well, let me tell you a little bit about Dr. Tollefson before we get started. I want to read her bio. She has done some amazing things and is continuing to do some amazing things that we'll be able to share with you today too. She is a American College of Obstetrician and Gynecologist Fellow. She is a certified diplomate of the American College of Lifestyle Medicine. She's an obstetrician gynecologist in the Denver, Colorado area and a professor of health professions department at Metropolitan State University of Denver. And it's where she's created and oversees the lifestyle medicine program and the wellness coaching and lifestyle medicine pathway. Dr. Tollefson is a graduate of Creighton University, where she received both her Bachelor's of Science and Doctorate of Medicine degrees. She completed an obstetrics and gynecology residency at the University of Missouri in Kansas City and received her board certification in this specialty. She has also received her board certification from the American Board of Lifestyle Medicine and a fellowship in lifestyle medicine from ACLM. She is a lifestyle medicine leader within the American College of Lifestyle Medicine, as well as the field of women's lifestyle medicine. So she founded and co-chairs the ACLM Women's Health Member Interest Group, as well as the Pre-Professional Lifestyle Medicine Education Member Interest Group. She serves as the ACLM Executive Board Secretary and serves on the Education and Membership Committees. I mean, wow, already. She is the editor-in-chief of Improving Women's Health Across the Lifespan, which is an international, she is an international speaker, women's health consultant. She leads Paving the Pathway to Wellness groups and recently co-authored the Paving the Path to Wellness workbook with Dr. Beth Frates and Dr. Amy Commander, and just published, like fresh off the press, just published Paving a Women's Path Through Menopause and Beyond. So you can see why this is so timely of doing this workshop too. She is a breast cancer survivor and thriver through the power of lifestyle medicine and enjoys spending time in the Colorado outdoors with her husband and 3 children. So we are so blessed to be able to have Dr. Tollefson with us. You can see her passion just within her bio of lifestyle medicine and women's health. So thank you, Dr. Tollefson, for being with us, and we will hand it over to you.
Thank you for the invitation. It's a pleasure to join you again. So today I'll discuss supporting your journey through menopause, though it will have information that's useful whether you are just starting to have hot flashes or whether you went through menopause decades ago. But before we get to the literature, I'd like to share part of my story with you. I always knew I wanted to be a doctor and help people. Here's some of my kindergarten art, and I'm not sure if those are knee pads or a very special doctor skirt that I'm wearing, but I don't really remember any discussions about menopause while I was growing up. After medical school, I became a physician. I'm the second one from the right on that picture, and entered my obstetrics and gynecology residency. But during this time, I was only focused on learning and not really on my personal health. I truly felt invincible, like I could survive on very little sleep, doing stressful surgeries, rarely exercising, and eating the healthiest thing I could find in the hospital cafeteria. I learned about menopause, but really most of my training focused on obstetrics, delivering babies, doing surgeries, and treating gynecologic problems with medications. Now, during my residency, the Women's Health Initiative study came out exposing some of the risks of using hormone replacement therapy. So I saw a lot of women stop their hormone replacement therapy and struggle with menopausal symptoms. When I would see these patients in clinic, I often felt like a failure. I really had very little to offer these women if they didn't want hormones. In medical school and residency, I don't remember a single lecture on the impact of nutrition, exercise, stress, sleep, or social connection on health, and especially not on the health of menopausal women. When I graduated from residency and started private practice, I personally started researching and using nutrition, physical activity, stress, sleep, and social connection to get healthier and to help my family get healthier too. As I started to learn more about lifestyle as medicine and embrace healthier habits, I felt better. I educated my patients about what I was learning, and they felt better. And the more I was inspired to do research and learn how lifestyle as medicine could be used alongside conventional medicine to prevent, treat, and sometimes reverse chronic disease. I was seeing the impact of lifestyle medicine on my patients, especially those going through menopause. Eventually, I left the stress of full-time clinical practice, so I stopped delivering babies in the middle of the night and stopped doing hysterectomies and focused on office lifestyle medicine for women, seeing mostly peri and postmenopausal women. I found that these women were often at a time in their lives when they wanted to refocus on themselves and their health. I thought I was as healthy and happy as I had ever been, and many of my patients were as healthy as they had ever been, until I got the call that started my menopause journey earlier than I had expected. I had a normal 3D screening and mammogram at age 40 and 41, and no significant family history of breast cancer and no symptoms. But a routine screening mammogram at age 42 showed a 2-centimeter mass invading my chest wall, which was right behind my nipple that I was unable to feel, even though I'd done thousands of clinical breast exams as a gynecologist. I was diagnosed with a very aggressive breast cancer that required a bilateral mastectomy. I went through immediate drug-induced menopause during 16 rounds of aggressive chemotherapy and then had my ovaries surgically removed. So I was definitely menopausal, and due to my breast cancer type, could never be on hormones. I assumed most of my symptoms while going through chemotherapy and surgery were from the chemotherapy, but after chemo ended, I realized many of my symptoms didn't go away. Hot flashes, night sweats, fatigue, aches, mood changes, and brain fog seemed to linger. Now, I was frustrated. I had worked so hard to get through cancer treatment, and then I still felt crummy at the end, and I had multiple reconstructive surgeries ahead of me. So I knew I didn't want to just be a survivor. I wanted to thrive again, and I knew I needed to return to what had helped me get healthier after finishing my residency. Although I was already a lifestyle medicine expert and already embracing healthy lifestyle habits, I wanted to really focus on learning all that I could about menopause and lifestyle medicine to help me go from being a survivor to being a thriver again. I started digging deeper into the menopause lifestyle medicine research to help myself, and I was surprised to find out how strong the literature was, yet how difficult it was to find evidence-based, cutting-edge information for menopausal patients on lifestyle medicine. Now, during cancer treatment, I learned that surviving was not fun, but sometimes it was really all that I could do. And have you ever had a time in your life when surviving was all that you could do? You didn't want to stay there forever, right? You wanted to move beyond surviving to thriving again. So I remind my patients, if a plant is living, it's growing and changing, but it needs the right soil in order to thrive. Healthy lifestyle behaviors nourish our soil and allow us to thrive. So what do you need to thrive? Lifestyle medicine will not make you perfect. It will not make all of your health problems go away. My post-chemotherapy neuropathy and anxiety about a recurrence haven't gone away, but I'm thriving, even with my limitations and medical problems. And I'm using lifestyle as medicine to have a healthier body, a more peaceful mind, and a more joyful heart through menopause, midlife, and beyond. And I invite you to join me on this journey too. So wherever you're at on the menopause journey, this information is for you. Menopause has officially occurred when a woman has had no menstrual period for 1 year, unless, as in my case, menopause occurs immediately due to reasons like chemo or surgery. So whether you are peri or postmenopausal, you deserve to thrive and to live a healthier, happier, more joy-filled life too. and lifestyle medicine can give you the fertile soil you need to do just that. So the lifestyle medicine areas that we'll discuss today as they relate to menopause are nutrition, physical activity, sleep prioritization, stress management, and social connection. So first, let's discuss nutrition. I'm going to try to cover this quickly as I covered nutrition in more depth with my last webinar for you, which you can still access. But I'll do a quick summary for those of you who missed it or want a refresher. First, let's talk about protein. Protein is really important for women during the menopausal transition and beyond. When women go through menopause, they typically lose muscle and gain abdominal fat. Now, protein is needed for maintaining or gaining muscle. So we're not talking about becoming a bodybuilder here, but just having muscles that allow you to do activities of daily living and enjoy life. Protein is also important for bone strength and a strong immune system, but many women don't get enough protein in their diets, especially after menopause. Now, there's really strong research that's shown us that women who eat more plant protein during this time have less cardiovascular disease, less premature and dementia-related death. Women who eat the most processed meat, on the other hand, have the highest risk of dementia-related death. And women who eat nuts as a substitute instead of red meat, eggs, or dairy products have a lower risk of dying prematurely, according to the literature. Now, since most menopausal women in the US eat too little plant protein for optimal health and too much animal protein for optimal health, I encourage most of my patients to increase their intake of plant protein and decrease their intake of animal protein. But I don't ask them to exclude all animal products unless they want to, of course. But I want them including a lot of healthy plant sources of protein for optimal health. For women with hot flashes and night sweats who want to know what they can do to try to decrease their hot flashes through dietary changes, I recommend that they stay hydrated, as even mild dehydration can trigger hot flashes in some women. Enjoy plant protein, including whole or minimally processed soy. Avoid alcohol, caffeine, coffee, or spicy foods if they trigger hot flashes for you. Get enough omega-3 fatty acids through ground flax seeds or other sources. Eat a lot of whole and minimally processed foods and lots of plants. And avoid the sugar cycle as it increases mood swings, which is already a struggle for many peri and postmenopausal women. Now remember, this won't necessarily take care of everybody's hot flashes. So if you still are struggling with hot flashes, menopausal symptoms, go see your healthcare provider. This does help a lot of women, but anyway, stay connected with your healthcare provider, please. The same type of dietary advice that fits beautifully with the full plate eating plan also supports brain health in women. Eating the foods listed here have been found to especially be good for peri and postmenopausal brain health, support mental health, and also decrease the risk of dementia. With the help of your gut microbiome, which are the healthy bacteria in your intestines, when you eat these foods, you get brain-derived neurotrophic factor, or BDNF. And I love scientist Dr. John Rady calls it miracle grow for the brain, BDNF, miracle grow for the brain. So BDNF helps build new brain cells and helps their connections. So for brain health, it's important to eat the healthy eating way and to limit refined carbohydrates, ultra-processed foods, foods with added sugars, soda, and foods high in saturated fat, as they increase inflammation, can worsen mood, and increase the risk of dementia. So many of the same foods we've already discussed for hot flashes and night sweats and brain health are also good for bone health. And as Dr. Dean Ornish says, it's not like there's a different diet for preventing heart disease and one for decreasing the risk of cancer and one for supporting brain health. It's good just to eat a lot of whole and minimally processed foods, lots of fruits and vegetables, cooked whole grains and beans, such as what's included on that 75% plate. And it's great for most everyone, including peri and postmenopausal women. So the same overall eating pattern, again, that decreases some menopausal symptoms, supports bone and brain health, also decreases the risk of getting cancer, as well as helping cancer survivors like me thrive after active treatment. This type of healthy eating, the full plate living way, is also associated with improved sexual health in peri and postmenopausal women. Now, if you feel like I went through these last few nutrition slides too fast and you want even more information about nutrition, I encourage you to watch my last webinar. The 75% full plate living plate is fabulous for females. So remember to make at least 75% of your plate fruits, vegetables, beans, and cooked whole grains. So now let's move on to physical activity. The guidelines for physical activity for women who are peri or postmenopausal recommend 150 minutes or more of at least moderate intensity exercise each week. So that's where you can talk while exercising, but you can't sing. They also recommend strength training at least 2 days a week. So why does your doctor tell you to exercise? Exercise is important for so many reasons besides maintaining or attaining a healthy weight. Exercise supports your chances of living independently for decades to come, increasing your bone strength and decreasing your risk of frailty, falls, and broken bones, which are what often lead women to going into assisted living or into a skilled nursing facility. Exercise has been shown to improve quality of life, It increases energy, and who doesn't want more energy? It has many physical health benefits, including helping with blood sugar control, decreasing the risk of cancer, heart disease, stroke, high blood pressure, and more. It also helps women sleep better, decreases muscle aches, and decreases hot flashes and night sweats too, even if you do sweat while exercising. Loss of estrogen with menopause also contributes to a decrease in muscle and an increase in fat in most women. When you lose muscle, your resting metabolic rate decreases. And these are the calories that you burn while doing nothing besides breathing. And this typically leads to weight gain, about 10 pounds. But you can combat this. One of the best things to do is to do some resistance training, as it's been shown to increase life satisfaction, positive well-being for peri and postmenopausal women, and it helps keep your lean muscle mass where it should be and not have the extra fat mass gain. Resistance training also helps decrease hot flashes and night sweats, and also really helps bone strength. And don't worry, you're not going to get huge muscles without a lot of specialized training. If you're new to resistance training, I encourage you to initially work with a physical therapist or a personal trainer so that you don't get hurt and are working out at a level where you will receive benefit. And don't worry, a little resistance training goes a long way, and you can do a lot with resistance bands and small weights if shown how to use them properly. That's what I do when I do resistance training a couple times a week. Yoga in menopausal women has been shown to improve sleep, decrease menopausal symptoms like hot flashes, decrease anxiety, stress, and improve mood. So consider trying yoga if you aren't already doing so. Now, women typically sit more and more as they go through menopause and beyond, but sitting a lot is associated with an increased risk of cardiovascular disease, diabetes, metabolic syndrome, obesity, and early death in women. Increased sedentary time also predicts more night sweats. A new report showed that vigorous exercise that interrupted prolonged sitting, so like when you're sitting for hours on end, if you sit for hours on end, watching TV or doing Zoom calls, sometimes like me, just 15 to 30 seconds every hour, like running up and down the stairs, improved cardiovascular and metabolic health. So I encourage you to consider setting a timer to remind yourself to get up and move at least once every hour or at least twice an hour if you're diabetic. You can stretch, so even a little is okay. You can stretch or even do some vigorous activity if your healthcare provider has cleared you for vigorous activity. Research shows that exercise supports brain health, improves mood, and decreases the risk of mental illness. It also shows that exercise lowers the risk of dementia and may help women with mild cognitive impairment improve their cognition. Sitting too much also negatively influences postmenopausal sexual health and more than doubles the risk of sexual dysfunction. Research shows that postmenopausal women who exercise have a better sexual quality of life. So what's preventing you from being as physically active as you want to be? Maybe you don't have time. That's a struggle for me. But could you schedule it and make it a priority? Do you hate to sweat? Remember that if you have hot flashes, it'll actually decrease hot flashes and night sweats over time. Does exercise bore you? You can consider try adding variety and investigate what's fun for you to do. Do it with friends, mix it up, or maybe even work with a trainer. Do you have a condition that makes you hesitant to exercise? Or maybe you did resistance training in the past and got hurt. Talk with your healthcare provider as you still may be able to move more and may benefit from a referral to a physical therapist to help you put a personalized plan together. And whatever you do, remember to infuse joy into your movement and be kind to yourself. So I love that 75% concept with food and also with physical activity. So walking is great exercise. If exercise is not your thing, and I understand, I am not someone who dreams of running marathons. Start with small physical activity goals and move in the right direction. The greatest change in health actually happens when menopausal women go from being very sedentary to even moving just a little. You don't need to run marathons, just move your body more in ways that feel good for you. For me, I found that Zumba dancing for 20 minutes every morning while watching a fun YouTube channel is what's working best for me at this time in my life. This all fits with the full plate living 75% concept. You don't need to be perfect with physical activity to have great benefit. Just move more and sit less each day. Now let's briefly talk about sleep in menopause and beyond. 35 to 60% of women over age 50 struggle with sleep. So if you're struggling, you're not alone. It's a myth that women need less sleep when they get to menopause. The Sleep Foundation recommends 7 to 8 hours of nightly sleep, not just time spent in bed, for optimal function. And with perimenopause comes night sweats for many women, increased night awakenings, and less deep sleep. So even if you used to spend 7 hours in bed prior to menopause and sleep 7 hours, now you may still spend 7 hours in bed, but still be overly tired due to poor quality sleep. Sleep definitely becomes more challenging with age, but there are things we can do. Don't despair. Sleep is just as important for peri and postmenopausal women as it was before that time. Your brain is super active while you sleep. The brain produces beta amyloid protein every day, and beta amyloid is associated with Alzheimer's disease. The lymphatic system is most active at night, and requires adequate sleep. The lymphatic system you can think of as a waste disposal system for your brain. It flushes away the harmful products like beta amyloid. But if you aren't getting enough sleep, you're not adequately clearing waste products from your brain. And research has shown that women who sleep less than 7 hours per night are more likely to get dementia. Adequate sleep helps keep your memory sharp, allows you to learn new skills and facts, solve problems easier, and helps improve your memory. And it even improves creativity too. Sufficient sleep also strengthens your immune system, helps you recover faster from injury, decreases your risk of developing diabetes, or helps you control your sugar better if you do have diabetes. It improves heart health, blood pressure, decreases your risk of heart attack and stroke, and it decreases pain sensitivity, which is beneficial if you experience aches and pains like many women during perimenopause and postmenopause do. It also increases energy and combats fatigue. Now, many women struggle with unwanted weight gain during peri and postmenopause. With menopause and with insufficient sleep, many of the same things happen. So if you are perimenopausal or postmenopausal and you're not getting enough sleep, you have a double whammy. Ghrelin, the hunger hormone, increases with menopause and with insufficient sleep. And along with that are cravings and often weight gain and fat. And if you're like me, you don't crave broccoli in the middle of the night. With menopause and insufficient sleep, leptin, the hormone that makes you feel full, is decreased. So even after a big meal, you still may feel hungry. Your metabolism slows, it becomes more difficult to control blood sugar, and muscle mass decreases. So if you're sleep deprived and menopausal, watch out. So this is yet another reason to prioritize sleep during this time in your life. There are things that you can do. Your daytime habits impact your sleep. What you do during the day actually prepares you for a restful night. So for better sleep, enjoy foods that are rich in tryptophan, such as seeds and nuts and beans. Eat a fiber, fruit, vegetable, and bean-rich diet, which is associated with improved sleep quality and fewer nighttime awakenings. Avoid junk food as it's associated with increased fatigue, insomnia, and worse sleep quality. And try to get bright morning light outdoors, I guess, if it's not too cold in your area. As far as bedtime routines that help peri and postmenopausal women, according to the research, try to go to bed around the same time every night. Try to keep your environment and yourself calm, as stress and anxiety can make it harder to fall and stay asleep. Turn off screens and dim the lights as it gets closer to bedtime. You can try cold, tart cherry juice 20 minutes before bed, which increases melatonin, and we know that melatonin naturally decreases with age. And what's cool is that cherry juice doesn't have a hangover effect that melatonin supplements sometimes cause. You may want to do some stretching exercises or relaxing yoga poses, or engage in other relaxing pre-bed activities such as reading a calming book, praying, meditating, or writing in a gratitude journal. Consider how you can make your bedroom more like a cave, cold, dark, and quiet. The best temperature for sleep, according to the research, is about 65 degrees. You may want to use room darkening shades to keep your room dark, and use earplugs or white noise machine if needed too. Also, consider grabbing some extra pillows if you have aches and pains, as they can help you get more comfortable too. Some other bedtime routines that can improve sleep are to take a warm bath or shower before bedtime. It's actually been shown by the research to improve sleep quality and increase deep sleep, which happens to typically decrease or become harder to get as we age. Keep your hands and feet warm. So that's why I picked the picture of them with their cozy socks during sleep, which has been shown to improve sleep too. Put on comfortable pajamas that are not restrictive and that will help you to keep cool if you have a hot flash. Try layered sheets, have a fan nearby in case you wake with a night sweat, and use the bathroom one last time. So when it comes to sleep, let's think about that 75% concept again that I love with whole plate living. So when it comes to sleep, try not to stress, because you can have significant benefit from prioritizing sleep, even if you still don't sleep like you used to decades ago. Many women frequently get up in the middle of the night to use the restroom, myself included now that I've joined the Menopause Club. You don't have to sleep soundly, uninterrupted for at least 7 hours to benefit from getting sufficient sleep. Start with making sleep a priority. And if you still struggle, reach out to your healthcare provider, as there's a lot that can be done to help you with sleep. So now let's talk about stress. Stress doesn't continue after menopause, does it? I like to call the stress that we experience in peri and postmenopause menostress. Hormonal changes during the menopause transition increase our sensitivity to stress. So you're not crazy if you feel like the stressors that you used to sail through without a problem now cause a lot of stress. During menopause, progesterone levels decrease, and that's the hormone that supports calmness. And cortisol, the stress hormone, increases. This can worsen menopausal symptoms and cause mood swings.
Hi, everyone. It looks like we lost Dr. Tollefson for a little bit. We're just going to wait for her to refresh her screen and join us. She should be back as soon as possible, and it looks like she'll be up in just a second.
Yep, this is technology. So thanks for being patient with us.
Welcome back.
Hello, I'm so sorry. I am pulling up my presentation on a different computer. Nothing like a little stress when we're going to discuss stress.
Well, I'm going to hand it back over to you. We'll pop back on if we need to.
And I was discussing stress, wasn't I?
That's correct. Yep.
Nothing like a little.
Take a good breath yourself and let's lower the stress.
Oh my goodness, I am so sorry, everyone. I present all the time and I have never had that happen, but luckily we have a second computer, and thank you for hanging with me. Let's see, I think we are right here. So exercise and stress. I think I need some exercise right now. I'm actually sitting on one of those bouncing balls, so maybe I can move a little bit and decrease my cortisol. But women who exercise regularly manage stressful situations and chronic stress better than women who do not exercise regularly. Exercise decreases that cortisol, the stress hormone, and it produces endorphins that improve mood. And what's so cool is that regular aerobic exercise is important, but even doing just 5 minutes can have an anti-anxiety, anti-stress impact. So not surprisingly, sexual health is worse for women who are very stressed. Chronically high stress women report lower genital arousal and increased distraction. And since stress and distraction worsen sexual health in peri and postmenopausal women, it's not surprising that doing some stress reduction and mindfulness techniques have been shown to decrease stress and improve sexual health too. Now, the food that we eat can be a negative source of stress for our body, or it can help us handle stress well. A diet high in added sugars and saturated fat worsens stress and common menopausal symptoms. Eating highly processed food, like junk food, leads to blood sugar rises and crashes and increases the risk of release of cortisol, the stress hormone. Caffeine can also increase our heart rate, make us hyperactive, and make us more susceptible to stress. But eating an anti-inflammatory diet, such as a whole food and plant-rich or Mediterranean-style diet, which aligns with a 75% plate, decreases inflammation and helps us better handle stress that we encounter. Eating high fiber foods and fermented foods such as tempeh, kefir, yogurt, or sauerkraut, they support gut microbiome health. And this is important as for our mood regulation, as much of our body's serotonin, that's the hormone that helps us handle stress, is actually produced in the intestines, and it relies upon a healthy and flourishing microbiome. Adequate magnesium intake is important for how we metabolize cortisol, the stress hormone. And foods that support relaxation include leafy greens, avocados, bananas, and my favorite, dark chocolate. Just try to get it where it's at least 70% or above. And some herbal teas such as peppermint tea, chamomile tea, as well as green tea. They all contain L-theanine, which supports relaxation too. So as a peri or postmenopausal woman, you likely have many years of experience handling stressors like I do. I encourage you to use what's worked well for you in the past to manage stressful times and to try some new things. Set boundaries to better protect your time or energy. Consider whether your home environment is helping you relax or causing you stress. And I know my house, when it gets too messy and I can't find what I'm looking for, my stress definitely increases, or when my computer stops working in the middle of a presentation. Connecting with women who are also peri or postmenopausal can help with stress resilience too. Prioritize sleep, as sleep and stress are really linked together. And last, get professional help if needed. Professionals can help you to deal with extreme stress, trauma history, or even the daily stressors that seem to pile up and affect all of us. So when you're stressed, how do you talk to yourself? In fact, I was trying this just a second ago when I was saying, okay, just work through this, get this pulled up. But how do you talk to yourself? Many of us women were our own worst critics, or we hopefully want to try to use positive self-talk to help talk you through a rough time. How we talk to ourselves really impacts our stress. So try to talk to yourself like you would a dear friend going through a stressful time. Try practicing gratitude exercises, such as thinking of 3 things that you're grateful for on your morning walk or drive each day. Practice mindfulness, and seek out activities and people that make you laugh and bring humor to your life. Now, I like to use the 75% concept with stress. And this is kind of funny what just happened with going through the stress part of this presentation, because you can't make stress go away. Stress is part of life. Stress comes with change when something we care about is threatened or when we have expectations that are not met. So I wanted to show you, this is actually our Christmas picture. I was trying to get my whole family to do this picture to cooperate in Costa Rica, and the sun was setting faster and faster, and my boys were tired from a long day in the sun, and they were poking each other, making each other laugh and annoying each other. So even though I'm smiling and we look calm, I was having some stress, and I still could use some help working on stress resilience. But lifestyle medicine, whole health, it's all a journey, one step at a time. So don't beat yourself up if you can't handle stress beautifully all of the time. Just try to make steps in the right direction, work on stress resilience practices, and be kind to yourself without shame, blame, or guilt. So now let's discuss social connection throughout the menopause transition and beyond. So loneliness is really common. 1/3 of women age 45 or older report being lonely. It's just something that we don't usually talk about. You don't walk up to people and say, hey, guess what? I'm lonely. Women really crave connection, especially with other women with shared experiences. It's important for our physical, mental, and emotional health to feel like we belong. Social connection is important for brain health. It decreases the risk of dementia and improves memory, and also improves mood and mental health. So this was a cool study that looked at a group for 28 years, and those who had more social connections in their 60s decreased their risk of dementia. So there's a protective effect of social contact against dementia. And those who had more frequent social contact, especially with friends, had higher cognitive reserve. Social connection is important for many areas of health, not just mental health. Heart disease is still the #1 killer of women. In a study that looked at about 57,000 postmenopausal women with no history of heart disease, they followed them for 4 years, and what they found were that women with high loneliness and social isolation were almost 30% more likely to have a heart attack, stroke, or cardiovascular related death during those 4 years. This really highlights the importance of connections. So loneliness is very common, and many of my menopausal and postmenopausal patients feel nervous about reaching out to increase connections, or they feel guilty about not having more connections. And I felt this way and still feel this way sometimes too. That's natural. But it's important to work on connections and prioritize them, and to think about what your obstacles are to connection. With mindfulness, we can decide which connections we need to reestablish, strengthen, or create. We can foster meaningful social connections that will support our health as well as the well-being of those we connect with for decades to come. Some ways that you can improve your social connections are to join a women's group or get more involved at your church or house of worship or with your faith community. Take a class at your local university or community college. Take a fitness class at your community center or local YMCA, or take a cooking class. Take lessons to learn a new hobby. Join an organization for people who enjoy the same hobbies or interests that you do. Look in your newspaper for local gatherings that you might enjoy. Invite an acquaintance out for coffee. Join a book club or a group that meets to play cards or board games regularly. And if you can't find one, consider starting one. And you also all have an invitation to join the Paving the Path to Wellness program that I'll discuss momentarily. If you'd like to connect with other peri and postmenopausal women working on their well-being, it might be a good place for you. So once again, don't let perfect be the enemy of good. I love that whole plate living, that 75% concept. Reach out and connect. It's okay if you aren't naturally an extrovert. I'm not either. It's okay to feel awkward. I felt that way too. And you are not alone. Connection takes work, but it's worth it. You deserve meaningful connection for your health. So to wrap this up, I want to share with you that I'm on the board of directors of a nonprofit organization called Paving the Path to Wellness, created by Dr. Beth Frades, a Harvard faculty member and physician. The Paving Steps are the 12 steps to help participants have a healthier body, a more peaceful mind, and a more joyful heart, along with helping you make it work through the action steps. As Dr. Frades and I know that behavior change can be really hard. She and I were two of the first physicians ever trained as wellness coaches in the United States many years ago. We realized that it's not just about nutrition, exercise, stress, sleep, and social connection, though those are really important, but it's also about your attitude, taking time out for yourself, managing and increasing your energy. We talk a lot about time management, but what about energy management? Investigating in what works best for you. It's great if it works for everybody else, but it's what works for you. And incorporating variety into your life, as well as learning about setting goals and how to do that in a way that increases your chances of success. And all of this, we want all of these actions to align with your life's purpose. We want healthy eating. We want moving every day, practicing that stress resilience and getting adequate sleep. We want that to align with your purpose. So Paving the Path to Wellness was created within the Harvard Hospital system as a 12-component program delivered over 12 weeks as an in-person group setting by Dr. Beth Frades over a decade ago, but it's since been modified for various groups, such as the group for breast cancer survivors was the first time I joined in right after I finished active treatment, and it's delivered virtually as well as in person. So together with Dr. Amy Commander, she's the other co-author of these couple books. She's a Harvard oncologist and director of the Lifestyle Medicine program in the Cancer Center there. Dr. Frades and I and Dr. Commander have written 2 books where all royalties go to our nonprofit organization, Paving the Path to Wellness. These books can be used on your own with a group of friends, or you can join one of the online paving groups by visiting the website Paving Wellness, all one word, pavingwellness.org. And as I mentioned earlier, I struggled with finding good lifestyle medicine evidence-based info while going through menopause. But when I discussed the struggle with Dr. Beth Frades, my co-author, and she encouraged me to write the book that I thought women would want on lifestyle medicine for women going through menopause or who were postmenopausal. And at first, I wasn't sure that I had enough information to really do a book, so I was calling it a booklet. However, after meeting with Dr. Frades every week and working on this for, it must have been over a year, we have 333 pages filled with colorful pictures, and we have a true book. In fact, I just got a copy from the publisher, so let me reach over here. So we just got a copy from the publisher, and it even has beautiful, beautiful color pictures inside. I'm so proud. So if you are interested in getting a copy of it, I think that there will be a link in the chat. It's on Amazon, but it still says that it's not available, but it will be available through Amazon. But right now it's available through Healthy Living, the publisher, with free shipping. So my life's purpose is to help people lead healthier, happier, more joy-filled lives. And some days I feel like I'm just surviving, but usually now I feel like I'm thriving. But well-being really is a journey with ups and downs. But with lifestyle as medicine, we can all move toward thriving one step along our path to wellness at a time. For more information on the program or the book, visit pavingwellness.org. You can also check out my website at drtollefson.net, or you can email directly. If you don't get your question answered today, you're welcome just to reach out to me. Truly, my life's passion is to connect with people like all of you. So thank you so much, Amy, for inviting me back. Thank you, Amy, Michelle, and everyone for your patience during that stressful moment when I had my computer go down. I love the work that Ardmore Institute of Health is doing to support well-being, and I'm honored to have spent time with all of you today. Thank you all, and I welcome any questions.
Thank you, Dr. Tollefson. It is such an honor to have you here today. And thank you all for hanging in here with us with the tech glitch. So I don't think hardly anyone dropped off. So thank y'all for staying with us, and that you appreciate the topic today and that Dr. Tollefson. So thank you so much for joining us today, and we look forward to doing more in the future.
Thank you.
Well, we have a lot of questions. I wish we had another hour to go through them all, but we will try to go through as many that we can. So
you're all welcome to reach out to me if you don't get your question answered. I'm happy to help all of you.
Some of them were similar, so I think we can go through some a lot faster. I'm going to ask the most important one, I think, to me, because this is a question that I think most women have, and that is, how do you find a good provider that is well-versed in menopausal issues? I don't feel like the providers I have take it seriously.
So that is a great question, and one we often get asked. So most of the OB-GYNs, the obstetrician gynecologists, they're physicians. Then we have 4 extra years of training just in women's health. And so many of them most of them should have some basic knowledge as far as menopause goes, and most primary care providers. But there's the North American NAMS. I think it's the North American Menopause Society, NAMS. You can actually go on their website, and they have a list of providers who are part of NAMS. And those are people who have, they may not all be OB-GYNs, so there are a lot of OB-GYNs, but they're people who are really dedicated to wanting to learn more about menopause and to really provide the best care and treatment for their patients. They should be able to counsel you on the pros and cons of hormone replacement therapy. They may not necessarily know all about lifestyle. We're still learning. We're trying to get that information out in training. But I would say check out the NAMS provider directory would be a great place to start.
Excellent. And I went ahead and I put that link in the chat, and it's easy to remember because it's
menopause.org.
Menopause.org. All right.
That's actually where I went and looked for one as well. So
good.
All right. Next question. My sleep is so poor now that I'm in menopause. Now that I'm in menopause. Any suggestions?
Yeah, so that's a question we ask so often. many women struggle with sleep. They go to a provider, and unfortunately, they're often put on sleep medication, which I do believe has a role in certain circumstances. But there's really so much we can do, really so much that we can do as far as sleep hygiene, prioritizing sleep. There's Dr. Matthew Walker, I believe, has Why We Sleep, which is a great book on sleep if you really want to dig into the science. I actually use that book in the class I teach on stress and sleep. But there's a lot that you can do, a lot of great research showing that a lot of our behavior changes, the way we think about things, can help with sleep. So I shared some suggestions during the presentation. One of the things that has the most research is really keeping it about a wake up time and going to bed time very standard. So trying to keep on a regular schedule and not, sleeping more on the weekends. If you can't sleep, if you're struggling with sleeping after 20 minutes, you can't sleep, get up and do something relaxing and then come back to bed when you're tired. There's also a lot of research on cognitive behavioral therapy for insomnia, CBT. If you look into it, I think there's even maybe some online programs, but it helps you think about sleep in a different way. Because if you're really stressed about sleep, so now you struggle with sleep, and now you're really stressed, and I made you even more stressed because now you know the importance of sleep, and you go to bed and you're laying there and you can't sleep, it just makes you more stressed, which makes it harder for you to sleep, which makes you more stressed. So it can be that vicious cycle. So working with someone, a professional, to do cognitive behavioral therapy for insomnia can help you change the way you think, and has been shown to have great results. So I wish I could tell you that sleep gets easier with age, but unfortunately it doesn't. But the good news is that there's a lot that we can do as far as our lifestyle to try to help us with sleep. And then also, I think just being gentle with yourself. Like, honestly, more nights than not, I still need to get up in the middle of the night, which I never used to do before going through menopause. And I need to remind myself, because I know the importance of sleep. I also need to remind myself, like, it's okay. It's okay that I wake up in the middle of the night and I go back to bed, and it takes me a few minutes to fall asleep, and I need to do some deep breathing, but just experimenting with what helps you. And then the Sleep Foundation, their website has some great information on sleep hygiene as well. It's called Sleep Hygiene. So I'd recommend that you check that out.
And I know in the workshop, you also mentioned that if this is a persistent problem, that's a major issue for you, to please speak to your physician about your provider.
Yes. In fact, there's many women are often go undiagnosed with obstructive sleep apnea, because we have that kind of stereotype of the snoring and the large neck, but sometimes women will just present with fatigue. So that's why it's so hard. A lot of these symptoms that often come along with menopause can also be signs of something else. So if you're struggling with sleep, talk to your healthcare provider. Because there may be something else going on that can be fixed. So
we also did a practice workshop with a sleep specialist. And I'm going to put a link to that workshop in here too, because she talks a lot about the different things. She doesn't necessarily go into menopause, which I love that you kind of tied that with here. But I know that so many of these things, and I love that you say be kind to yourself and talk kindly to yourself, because I think that's a big part of helping that cycle not continue. I know I have to do that. I struggle greatly with sleep. And I have to be very disciplined with my sleep schedule, even going over to friend's house. I'm sorry, guys, I gotta go. It's time to go to bed.
Yes.
Yep. Doing those things. So I did put a link to that workshop. There are sleep specialists that do work with this. So as all of us have said, please reach out to your doctors.
Right. Great question. Let's look at the next question. There's actually a couple of these. So I'll share this one and understandably answer the other one as well. There are so many types of magnesium, which is recommended. And the other one was along the same lines, and it said, what do you recommend for magnesium supplementation?
Yeah, so I actually don't recommend supplementation unless somebody is working with their healthcare provider. You can check magnesium levels. I know magnesium is important for sleep, but I'm the fan of, for just in general, a fan of getting magnesium through our foods. And so I love leafy greens. Leafy greens, that's something I try to get in every single day. So I have, like yesterday I had some kale in my salad, but otherwise I try to do a smoothie every day where I get in my greens, because they are so important. So for me and for my patients, I recommend that they get magnesium through their food. So that's even like that dark chocolate. I get some of that like super, super dark chocolate, like 95%. And that's good. That has magnesium in it, some nuts. But those are great resources. But if you think that your magnesium might still be low, you're still struggling with stress, see your provider. They can actually draw a magnesium level to make sure that it's in the right level. And if not, they can look to see what is the best supplement for you. But otherwise, I don't recommend supplements unless you're working with your healthcare provider and working on a deficiency or with somebody who knows what they're doing with those.
Yeah, thank you for that. I think that's important with most supplementation. It's so easy for us to just say, oh, I can just take a supplement for that.
I
But
know.
we don't necessarily know what our blood work looks like.
Yeah, we don't. And there's so much that we're learning about plants. Like, oh my goodness, there's so much out there with plants that we just don't, over 25,000 phytochemicals or plant chemicals. We are just starting to touch the surface with what those truly do for us. So I'm not against supplementation. I just want to make sure somebody's working with their healthcare provider and doing it for a certain reason, and then just really eat those plants.
All right, here's a more technical question. What advice would you give to those of us who had a partial hysterectomy, but have not had any symptoms of menopause? Should we assume we are there or still in perimenopause? I'm 55, had hysterectomy at 33 years of age.
Sure, that's a great question. So, usually, as I mentioned before, usually we diagnose menopause as a cessation of menstruation or periods for 1 year. But if you've had a hysterectomy, obviously you're not having menstrual bleeding. And so then usually we do go based on symptoms. Most women, but not all, most women have hot flashes and night sweats. The average age of menopause in the United States for women is 51. But that means that the average age is 51. So there's that curve. There's some people who go through it in their mid 40s, and there's some women who go through it in their mid 50s or beyond. So if you haven't had any symptoms, the only way to really know would be to get a blood test, but to go in and get what's called a follicle stimulating hormone, or an FSH test, and your provider might want to check some other things, but that will tell us if you're you probably will need a blood test to be able to know if you've gone through menopause or not. If you were one of the I guess fortunate people who didn't have hot flashes and night sweats, or if you still are waiting to go through menopause. So I'd encourage you to go see a NAMS provider or your gynecologist, or even your primary care doctor. I believe would probably be able to help you with that. Good question.
Excellent. Hormonal headaches are a big issue. What about progesterone biocreams?
Oh, so the same thing. I recommend that somebody is working with somebody if they're using any of the different supplements or any of the progesterone creams. So yeah, I haven't seen a lot of evidence out there for the creams, but yeah, I would say work with a healthcare provider with NAMS. People who are in NAMS usually are really good about knowing the use of hormone replacement therapy if it has a role in managing something. But I haven't. It's not that it's out there. I haven't seen anything that shows that progesterone cream helps hormonal headaches. Not that I've seen. So I would say talk to a healthcare provider.
Excellent. I'm sure this one is a very common question. Can you actually lose weight post-menopause? I've gained 15 pounds even though I exercise, lift weights, eat at a caloric deficit, and I count macros. I lose inches, but the weight is not budging. What can I do to lose the weight?
Oh, that's a great question. So many women, so many women struggle with weight during the perimenopause and postmenopause. And it's hard with that loss of estrogen. It does become more difficult, especially if we're dealing with stress and sleep. I mean, even if you're doing everything perfect, it's really a challenge. And so I would say it looks like you're already, you already lift weights, so you're already working with someone, eating a calorie deficit, count macros. So I will say it's definitely more challenging. We're learning more and more about weight. It's not just calories in, calories out, right? There's a lot of other things going on. So what I would encourage you to do would be to work with a dietitian. If you want somebody who's more focused on plants, I think the American College of Lifestyle Medicine has a provider directory if you wanted to work with somebody who's more plant focused, but work with like a dietitian. And I would also recommend seeing a weight specialist. So I am a huge fan of lifestyle medicine. Lifestyle medicine first for everyone. We need lifestyle medicine even if somebody is using medications. But there are actually a lot of the medications used to help people who struggle with weight have come a long way, and there are some that are much safer now. And so even though I think it's a discussion that we need to like open up and have. It's great to eat healthy, and healthy eating really helps with weight. And even if you're struggling with it, you should still eat that way because it's beneficial for so many other reasons. But also no shame, blame, or guilt. It's something that we struggle with. And so if you've tried all of the different whole plate living, you've done all of those things, keep doing those. Don't stop it. But also don't feel bad about talking to a weight loss specialist because they do have training in that area, and it's not as easy as calories in, calories out.
Thank
Amy
you.
or Michelle, do you have any more to add about that?
No, I think you covered it. If you're doing all the lifestyle factors that you can, I think talking to a nutritionist sometimes can, I think a danger for us women sometimes is that calorie deficit can go either way, right? It can hurt us if we go too low. It can actually harm our metabolic rate. And so that can become a problem as well. So working with a nutritionist that can look at your metabolic rate, they can actually test for it. They can look at what you're eating and give you the appropriate nutritional advice. You can try that for a while. And yeah, I mean, if that's not working, then there may be other factors at play. There's a lot of other factors at play. So
yeah, and also
I think even like you've mentioned, you know, stress, sleep, there's so many other factors that really do play in. So it's kind of assessing those other different things that really could be playing in it as well.
Yeah, but reach out. Also, I think we used to think too, like all of the medications were so expensive, but now there's some different medications that are covered, especially if somebody has metabolic syndrome or type 2 diabetes. So I would say reach out and have that conversation. Huge fan of lifestyle medicine, that first and always, but don't be afraid to reach out and ask for help too. At least
I think it's been so taboo to want to reach out for help, but it truly, there are so many different wonderful professionals. I mean, this is why we love having professionals like you on, Dr. Tollefson, is because really there are some great people probably in your area or close to you, or that you could do telemedicine with, that could help you just kind of get to that next step to kind of give you that support. So use the tools that you have access to.
Very true. Yeah. My attention span and ability to focus is diminishing as I age. Do you have any recommendations?
Oh, so as a lifestyle medicine expert, I'm going to go to the behavior changes as far as attention span and ability to focus. So often with menopause, we do see some brain fog. You know, we do notice some different changes. And so I would say doing all the things that you can to support your brain health. So that's all, like the nutrition. Oh my goodness. I think of my smoothie every day when I have my smoothie, and I have some of the blueberries, which are great. I usually try to have a handful of walnuts or something every day, or a few walnuts, flaxseed. So ground flaxseed, unless you're getting your omega-3s through like a fatty fish source. The greens, once again, greens every single day, get your greens. So I would say do all the things you can to protect your bone, or to help your brain health. So that's your food, that's you're getting your physical activity, that's your stress, trying to manage stress as much as you can, even when crazy things happen, prioritizing sleep for sure, and then interacting with others, those social connections. So if you're doing all of those things, then you're doing, I believe, all that you can to support brain health. And even though we do see challenges with attention span and brain fog often with menopause, I tell anybody if they're struggling with it. So usually many women realize that it's early dementia. Usually it is not, but I do recommend that if anybody really is struggling and have tried the lifestyle things and it's not helping, once again, reach out. So my friend Dr. Beth Brady's told me, if you worry for 5 minutes alone, you need to reach out and call someone. And I love that. So if you're worried, which many of my patients are like, oh my goodness, I've been so worried that I have dementia. And it's like, no, reach out, please reach out and get information. As far as brain health, my favorite speakers, I just love them, are the Sherzais, Dean and Aisha Sherzai, Sherzai, I believe. But they have some great information on brain health, and also all of the food recommendations I believe would go along with the full plate living too.
Excellent, thank you. So we are at our 1 hour marker. It is one. So I do want to just check and see time-wise if we want to cover a few more minutes, 5 more minutes, or if we are at the end of the presentation. Dr. Beth, Michelle, this is all up to you. Okay. This one is, what is BF a guy thinks?
I am not sure what that is.
Yeah, it was
in the early presentation. I didn't know if it was something on the slide or not. So if maybe they BNF.
Oh, BDNF. BDNF.
Maybe this type. Thanks for that. Thanks for that, Catherine. BNF, maybe.
So BDNF it's so cool. The research is really cool. So BDNF is brain-derived neurotrophic factor. BDNF, and it's what John Rady calls miracle grow for the brain. And so back when I went to medical school, we thought that you had all the neurons that you would ever have, like you had them and then you just lost them and that was sad and that was it. But what we learned is that we actually grow new brain cells, we form new connections. And so we want BDNF being formed. And so BDNF formation, to get BDNF to be formed, like to maximize that, you want to be exercising. There's more BDNF made when we exercise. So exercise is super important. We need to, and we need to eat the whole plate living way, because BDNF requires a healthy gut microbiome, and to have a healthy gut microbiome, you have to be eating fiber. So that's perfectly the full plate living. And then your gut microbiome is flourishing. You're releasing BDNF, brain-derived neurotrophic factor, which has been really shown to help us with brain health. So some really cool research, In fact, my husband has a history of Alzheimer's in his family, and so I'm always like, you need to exercise. So yeah, it's so important.
Very fascinating. Here's one. What do you mean by the sugar cycle? I know that was mentioned a couple of times in various ways.
Of course. So the sugar cycle is when you eat something that has like added sugar in it, or you eat something that is like a simple carbohydrate, so like a white bagel, white rice, white bread. You eat something like that, or like a candy bar or chips, your blood sugar goes up, and then your body says, oh my goodness, the blood sugar is really high, I need to help control it. So you release a lot of insulin, and that helps your blood sugar to go down. But then you come with like a sugar crash, or then your blood sugar gets really low. And so then that often makes people feel like lethargic. They don't have as much energy. They often feel moody. And we see a lot of mood changes already with the menopause transition, with the change of hormones. And so that the sugar high, and then insulin goes really high, and then the sugar, goes into cells, and then you end up with that blood sugar crash. And then we know that when blood sugar crashes like that, that it actually leads us to go search out more food. And the food we search out, once again, isn't usually broccoli. It's usually the added sugars and everything. And so what I tell my patients is, it doesn't mean that you can't ever have your ice cream. It doesn't mean that you can't ever have your white bagel. Try to do it though, like add some protein, add some peanut butter to it. Or if you can make that white bagel, can you make it a whole grain bagel? Or can you like, if you love ice cream, maybe you could make some nice cream with some frozen bananas, which I love doing. But maybe you have some fruit along with it, so you're having some fiber, because fiber, all of those plant foods, that 75%, all of that helps us to have a more steady blood sugar, so that we don't have that up and down crash as much. So getting some protein in and eating some fiber, eating some plants are important always, but especially if you're having simple carbohydrates or something that could lead to that up and down, because that up and down sugar crash, it can launch more menopausal symptoms. It makes sleep worse. It can impact stress. Like, it just is negative in so many ways.
Very
good question.
True.
It's more of it's in the books too, but yeah, that's a great question.
You mentioned protein, and here's a question about protein. If you still like to eat animal protein, what type and amount do you recommend?
Yeah. So I guess I don't have a specific amount. What I would say is, if you're able to, it's a time when we're all looking at hormones, what hormones are in our meat. And so anything that you can look for, like that wild, pasture raised, wild, organic, I would say, look for those, or like with eggs, those things I think are beneficial, just because I feel like there's still so much we probably don't know about hormones. And so I would say do that if you're able to do, and then also think about it as not having to be the main part of your plate. So I love, like, the American Institute for Cancer Research actually has like the transition plate, and they have like where a steak is like the main part of the plate, and then they have a little bit of beans and like a mashed potatoes, and then they transition, so a little bit less. So that's what I would think of. I would say think of your 75% plate, right? So if you are continuing to do animal protein, which I still do some salmon. But I don't have, I don't have a giant piece of salmon. I have some, and I think of being able to incorporate more plant proteins to get in those beans, right? So to make sure that our animal protein or our animal foods aren't crowding out those plants. So I would say just think of it that way. Also in the blue zones, which are really cool. The blue zones are the 5 places on earth where people live the longest, the healthiest. If you look at them, most of them, 4 out of 5 of the areas are not, they do eat some animal products, but they eat it very differently than we typically do in the United States. They often eat small amounts, or on celebrations, or maybe a couple times a week. So I would say if you are, if you're eating animal products, just watch the amount, keep it in that 25% of your plate, watch your amount, and then try some other plant proteins. The more you try and embrace them, like we took my husband's father's, he's passed away, but he had a great chili recipe. And so we've actually played with it. And now it is amazing. It has all these like whole grains and beans in it and all the spices, and it's delicious. So you may want to try some other ways too of just throwing in some more plant protein and see how you do.
I'll also put in there, I know there are certain fish that kind of are a little bit more beneficial, kind of like salmon you mentioned. Yes. And I know we have a kind of a healthy 25 picks article. So I'll put that in the chat too, that y'all might like to look at.
Thank you, Amy. Some have a lot of mercury. There's just so much. There's so much unknown. It keeps getting harder and harder to find. To make sure that the animal protein that we're getting is what we want. So yeah.
Here's another question. This one came up when you were talking about tart cherry juice before bed.
Yeah.
Why have I noticed I sleep better having a bowl of ice cream before bed than when I have only beans and other healthy foods for dinner?
That's a really good question. I would, if I had to guess, I'm not sure, but if I had to guess, I would say maybe it's because you associate relaxing with ice cream, and that's kind of your body's way of relaxing and preparing for bed. So maybe what you could think of is there something else that you could do to make that ice cream healthier? So like, for example, I love my Vitamix blender, and I put frozen, I get the bananas really ripe, put them in the freezer, and then I take them out and I put like strawberries with them, and I make what we call nice cream. I think it's called nice cream. If you look for some nice cream recipes, you'll find them. But then that also has that fiber, so you're not just getting that sugar, like that sugar crash. You also get some fiber with it. Or if you're having ice cream, maybe it's a smaller portion, but with some strawberries. So if that's something that you really want, I would say don't deprive yourself of it. It can fit in that 25% part, but add some fiber with it so you don't have that blood sugar crash. And then also think about how you're feeling before bed, about that relaxation, maybe having a cup of chamomile tea or green tea that has the L-theanine, or maybe sitting down with some tart cherry juice to sip about 20 or 30 minutes before bed. Maybe that could become your new, like a self-care routine that you do, because it might be that ice cream is a self-care, like a self-care kind of ritual or something that you do. So that would be my guess to think about that. A good question though, I'm not sure.
Very good. I'm going to ask this as our last question. I know there were some other ones, they have been answered during the presentation, so we'll just skip to this one. I love that you mentioned flax meal. What would it be the recommended amount? How much flax meal should somebody have?
I don't know if there's an official recommended amount. You do want to make sure that it's ground. So like the other day I got my shopping order, and I noticed that it was whole flax seeds. I'm like, oh, I need to grind them. So in order to get the benefits, they really do need to be ground flax seed or flax meal. And I don't know of an official recommendation. I can tell you what I put in my smoothie. I make sure that I get a tablespoon or two every day. So I get a big heaping tablespoon and put it in my smoothie every single day. So I guess I don't know any official recommendation, but I think some of the research has probably been done on like 1 to 2 tablespoons. You can put it in a variety of different things, or in different dishes. But for me, I put it in a smoothie, and then when I just really, really blend up my smoothie, I can't even tell that it's there, but I'm getting some good omega-3s.
Yes. Yeah, 1 to 2 tablespoons is what we've heard as well, or have used in the past. Well, thank you so much for taking the time to answer all the questions.
Of course.
And for such a wonderful presentation.
Oh, thank you.
Many thank yous in the chat too from everyone. So we thank you as well for being with us today and sharing your time, sharing your wonderful knowledge, and answering questions. So thank you so much for being with us today. And thank you all for joining in.
Yes, and thank you for your patience during that stressful time during the top part on stress. So thank you. It was an honor to connect with all of you today. Thank you so much, and reach out if I can be of assistance.
Thank you so much, Dr. Tollefson. Y'all have a wonderful day. We'll see y'all next time.